I'm Melissa Pierce. I'm the CEO of Community Action Wayne Medina, and we're the lead agency for Rural Mobility Solutions. Well, we're in a very rural community. The Wayne County population in total is about 116,000, and Worcester is its county seat and also the population hub, and it's under 26,000. So agriculture remains one of the most production focuses, but the county offers a really business-friendly environment with a robust manufacturing focus. So that's really where we focus. As a nonprofit that focuses on a two-generational approach as well to family education and self-sufficiency, it's our responsibility to identify the community needs and gaps. So whether it's Head Start or financial literacy classes, we really focus on helping people find solutions to their challenges in hopes that those actually become long-term solutions. So for many years, a gap has been identified as lack of access to opportunity, and so the need for transportation. And so we've progressively built options, and we run the Cities program. And so what we found was many of our customers have the smarts and skills to be successful. They just lack the access to opportunity. So RMS, the purpose was to open that opportunity to folks using the tools of the transit system, which was the Paradox Prize funds helped us to acquire a transit routing system so we could really provide access to employment that was affordable, reliable, and safe. So we were able to bring Wayne County residents from throughout the county into Worcester with all of our larger manufacturing concerns. We started in mid-December 19, and the pilot was launched well, and then the pandemic hit, and it quickly diminished the economy of scale we were hoping to fill with the micro transits, which was having enough passengers to pay for the service. But then social distancing really kind of quashed that. So some of the takeaways include that riders many times had multiple challenges to solve. And so we kind of had a case management approach. As a social service agency, we kind of connected them to resources, but we made them accountable for scheduling their rides, cancellations, and payment. Many of the riders were coming through staffing agencies. And that presented a challenge because many times their schedules were erratic, shifts were canceled at the last minute, workers were dismissed early, or the COVID shut them down unexpectedly. So we actually had one recovery house. We were transporting all of their men to different work sites. And then once the pandemic hit, they shut down the workforce opportunity because they didn't want COVID brought into the house. We also changed our cancellation policy so that riders weren't penalized when they had to quarantine unexpectedly. But each rider who participated in the program really grew their opportunity. Some were even saved enough money to buy a car to give them mobility beyond working hours. And even though that wasn't something that we were really trying to, encourage, it was a personal goal that they had. Some riders also shared information about good employer experiences with others on the microtransit. And so we noticed that there was some migration to improved wages and benefits. And we did notice that some went to Speed North America. So that was a good thing. For others, we assist them in locating affordable housing so they could stabilize and remain employed, or if they had a suspended driver's license, to keep their ride so that they can maintain employment. However, one of the obstacles of our pilot was that we didn't have a lot of hours for weekends and late shifts. So that was something we had to remedy. So to build sustainability, we look for an experienced partner in a way to leverage a better subsidy with like a federal grant so that we could really continue running our curb-to-curb work routes, which is important because we couldn't worry about a fixed route where the disparity of, having a rural isolated situation wouldn't allow for that. So basically, we were able to we wanted to reduce the cost of the ride and expand operating hours. So we've been able to expand for 7 days a week and cover all 3 shifts.
Wow.
And we saw a solution as partnering with SARTA. an experienced transit system. And also by applying for federal grants, we're able to gain the necessary subsidy to lower the cost of the ride. So last summer, the county commissioners and us kind of worked together to survey the community, and we identified 4 buckets of need to address for the expanded transit system. One was expanding workplace sites through other areas of the county. Second was access to vocational training opportunities. Third was medical wellness rides to older folks, and then also people with disabilities, and also working with the courts so that people could meet their mandated appointments, again setting up for success if they were in recovery, reentry, or whatever their situation might be. So now we're working with SARTA and a private transportation provider to kind of grow each of these areas. And new micro transit vehicles are on order, and we're working to generate contracts to provide the necessary match we're going to need for ongoing 5310 or 5311 federal funds. So it's pretty complicated. We've had some hurdles, such as the private sector provider is having a hard time hiring drivers to meet the demand for weekends and those late night shifts. But SARTA is helping to pick up the slack for that. So Kurt Conrad and I from SARTA, we keep reminding each other that if it was easy, it would already be done.
Yeah.
So we keep pushing forward, and it's an upward climb, but it's certainly worth it.